So, Chio, I think it's important for the citizens of Ottawa to know that research-intensive organizations, such as the ones that we have here, that are associated with the academic hospitals in the area, are critical to raising the quality of care in the region. Studies have well shown that institutions, hospitals that conduct high levels of research also provide the best care. And I think for citizens of Ottawa, it's important for you to know that. I think in pediatrics, what we're focusing on at the CHEO Research Institute is both areas of prevention and areas of treatment. We have areas, research groups looking at the prevention and treatment of childhood obesity, which has become a huge epidemic in our region, and in which this generation of children may not live as long as their parents if this continues. We have an area looking at mental health research, children presenting to the emergency department with suicidal behavior, how best to treat these children. Emergency research is very strong at the Children's Hospital of Eastern Ontario, looking at health services, so which children require certain investigations. I'll give you an example, CT scan of the head for children with head injuries. We know there's a risk-benefit to this sort of technology. It exposes them to radiation, yet we don't want to miss any children with serious head injuries. So we're looking at decision rules deciding which children to image, which children not to image. And in the labs, we're looking at how to treat cancer. Leukemia has come a long way from children who used to almost uniformly die of leukemia. Now there's about a 90% survival rate for many forms of leukemia. But other cancers, not so successful, including brain cancers. So we have researchers that are looking at viruses that can selectively destroy tumors in the central nervous system. So there's a lot of research going on in many different fronts. I think the support of the community is critical. I think Carol brought up some of the challenges to do with pediatric research. Would you like to enter your child into a trial or not? And there are many decisions that enter into that I think we've only sort of just touched on. But I think the researchers and the ethics boards are there to pose the important questions, make sure that that research that's going to benefit the public is done. And in pediatrics, we pay a lot of attention to the protection of the child to ensure the best health outcome.